We are excited to have you on the Obstetrics and Gynecology Clerkship and will be working with you in our outpatient offices. You will be assigned one faculty preceptor and 1 or 2 resident preceptors. You'll work with these providers 1 half day each week. Attendings are physicians, midwives, and fellows. Our resident practice is located on campus at 135 Cannon Street, and our ObGyn faculty members will practice at several different sites, including North Charleston, Mount Pleasant, Somerville, and Daniel Island. Be sure to check Harbor for the address of your preceptor. Most of you will be working in general ObGyn clinics. Some providers see a mix of obstetric and gynecological patients. Other providers focus much more heavily on either gynecology or obstetrics. Morning clinics usually run from 8 o'clock to noon, and afternoon clinics often start around 12:30 or 1 o'clock and will finish around 4:30 or 5 o'clock. You will need to locate and review your preceptor's schedule in Epic. The number of patients you will see in a half day really varies depending on the provider and the visit type. Clinic sessions tend to be fairly high volume and fast paced, so it will be important for you to prepare for your clinic in advance so you're able to maximize your learning with the time you have with your preceptor. You'll notice when you review your preceptor's schedule that there are several different visit types. A new patient visit may either be a patient's initial obstetrical visit, or it may be a new gynecologic visit for a patient who is not pregnant seeing a gynecologist to establish care for their annual exam or specifically to discuss a problem. You will also see return OB patients on some schedules. These patients have already established their prenatal care through MUSC and are usually returning for their routine OB care. Pregnant women who are having specific problems, for example, vaginal bleeding or think they might be in labor, may also be listed as return OBs. If a patient is scheduled for a return GYN visit, it may be denoted in the comments to be an annual exam, or it could be to address a problem. Examples of acute and chronic problems we would see: vaginal discharge, irregular or heavy periods, STI testing, preconception visit, concern for urinary tract infection, incontinence, discuss contraception, painful intercourse, and breast concerns. These appointments are really designed to focus on the problem, so information should be collected about the chief complaint and any pertinent history. However, these established patients will have a much more thorough history in their chart, so you should review this. You will want to be as efficient as possible with the visit, and patients really appreciate that you've taken the time to read through and understand their chart. If you are unclear about whether to take a complete history versus a focused one, clarify with your preceptor before the encounter. ObGYNs will also perform several office-based procedures. These may be performed at the same time as their scheduled visit, or they might be returning specifically to have the procedure and nothing else that day. Examples of office procedures you might see include IUD insertions, endometrial biopsies, colposcopy, manual vacuum aspiration, and incision and drainage. While in the outpatient setting, you will have different roles depending on the type of clinic and the preceptor. Your roles will vary from observer to provider. Many of your preceptors will have you observe several patient encounters before performing your own interviews. You can complete non-invasive portions of the physical exam without a preceptor, but you will always perform breast and pelvic exams in the presence of your preceptor and a chaperone. It is a good idea to discuss what your preceptor expects of you before you see patients together or alone. If you have specific questions about your ambulatory experience, please discuss them with your preceptor during your first meeting together. We're looking forward to a great 6 weeks.